tailored to each nation's needs. John Collins is the editor of the London School of Economics report and joins us from London. Thanks very much for being with us. I mean, it's such a damning report, not just that the drugs war has been a failure, but it's actually fueling more violence and the black market.
Yeah, well, I think what we've seen over the last few years is an emerging international consensus that the war on drugs has been a total disaster. There's very few people advocating a continuation of the war on drugs. So what really the atmosphere that this report came into was saying, well, we all sort of acknowledge we really need to rethink international drug policies. We need a drastic change. And this report was really trying to say, well, what do the next steps for international policymakers look like? How do we actually go about ending the war on drugs? Because it's not really a question of if we want to end it, it's a question of how we end it now.
Absolutely. So what do you think this radical rethink must involve?
Well, I think what a lot of the things you suggested are a very good start. This idea that too much money goes to things that are totally ineffective, and in many cases not just totally ineffective, but actively damaging. Incarcerating vast amounts of people for drug offences is not an effective way to manage this issue. Spending huge amounts of police time and resources chasing commodities from one country to the other and the violence that goes with them is not an effective way to manage this issue. It just displaces it from one area to the other. On the other hand, we have programs that we know actually work, that are hugely beneficial in terms of economic. The relative costs are very minor compared to the benefits they give. So if we look at things like syringe exchange, opium substitution therapy, safe injection sites, all sorts of harm reduction programs, access to treatment programs, which are scientifically proven to work, have a huge benefit to cost ratio, are drastically underfunded at the international level. And the reason is because of this ideological pursuit of a war on drugs, this idea that, well, it's better to spend money chasing commodities than actually treating people who are ill.
Yeah, we are seeing a sort of gradual opening up of drug policies, particularly for marijuana in parts of the US and South America. Do you think that sort of thing works as well?
We certainly advocate this in the report. We say that the time has come that states have to start trying different forms of regulatory experimentation, different forms of policy experimentation. And what's happening in Washington State, what's happening in Colorado, and what's happening in Uruguay is a positive step. We will learn a lot from what these states and this country does, and we can then move forward from there. So we're not trying to say in this report that, we know what drug policy will look like in 30 years. We have the silver bullet solution to drug policy. This is one of the most complex issues we face. What we're saying is that let's start examining alternatives, let's learn from that process of examining alternatives, and let's move forward in that direction. What we've had previously is a kind of unipolar focus. It's that prohibition alone and this war on drugs approach will solve the global drug issue, and it hasn't worked. And so now it is time to try for alternatives.
And you've got some pretty big names supporting your findings, supporting this report. Do you think the time is right to overcome any resistance to making those changes?
I think so, and certainly, we produced this report with this upcoming UN General Assembly session in 2016 in mind. And the idea is the academic community is coming out and saying, look, enough is enough. It's time to really fundamentally rethink the international drug control strategy. States in Latin America have been calling for this for a number of years now. It's time for Europe to get on board, to start getting involved in the discussion. It's time for the US as well to take a different approach to this issue. And really, yes, we're calling on states to start to really rethink this.
OK, John Collins, thanks very much for joining us there from London. Well, just to support what John was saying there, a man has been arrested in Guatemala City after authorities found more than $2 million in tailored to each